Passive range of motion exercises help prevent muscle stiffness, maintain joint flexibility, and improve blood flow for patients with limited mobility because of illness or sedation. Caregivers can support and guide the patient during the exercises and watch for signs of discomfort. Before you begin, ask a nurse to help reposition or move any lines or medical equipment that may limit movement. Adjust the bed to a comfortable height to prevent caregiver strain. Slowly perform each exercise on both sides of the body up to 10 times or as tolerated unless instructed otherwise. Stop the exercise right away if you feel resistance. Begin with the patient's hands. Gently bend the fingers into a fist, then straighten them out fully. Next, support the arm at the elbow and wrist. Bend the elbow, bringing the hand toward the shoulder. Straighten the arm back to the resting position. Move slowly within the patient's comfortable range. To focus on shoulder rotation, position the patient's arm slightly away from their side. Bend the elbow to 90 degrees. Rotate the forearm toward the body, then away from the body. Next, support the patient's elbow and wrist. Lift the arm straight up to the ceiling toward the patient's head. Lower the arm down to their side. Keep the patient's arm straight and supported. Move the arm out to the side, away from the body. Bring the arm back to the resting position at the patient's side. Once you have completed the exercises on both sides of the upper body, move to the patient's feet. Support the foot at the heel. Gently point the toes upward toward the head. Move slowly within the patient's comfortable range. Move to the patient's knee. Support the leg under the knee and ankle. Bend the knee, bringing the heel toward the bottom. Straighten the leg back to the resting position or extension. Support the patient's leg under the knee and ankle. Bend the patient's hip, bringing their leg towards the chest or flexion. Then return the leg to the resting position. Next, keep the patient's leg straight and supported. Move the leg away from the body. Then return the leg to the resting position. For hip rotation, bend the patient's knee and support the leg. Rotate the leg inward toward the body, then outward. Talk with your nurse if you have any questions about the exercises. Your care team will decide if you need physical or occupational therapy.